There's been a lot of skepticism in the world about whether it's even possible to make a difference on AIDS, and also skepticism about whether development assistance, multilateral cooperation can contribute to that response. But the kinds of results we've seen in the last decade should really silence the cynics. We are making a difference.
UNDP has been a very important partner for many years. And it's very important that the National AIDS Commission has these high-level international partnerships because that brings in a level of expertise and technical assistance that we maybe couldn't get otherwise. We can then funnel that down to the groups who are working on the ground with the people that need that assistance.
It's important that we do outreaches such as this satellite table that we do because you get a wider view of people that you wouldn't target on a daily basis. At this bus terminal you have people coming in from all over the country and they're passing through, and if it's even just one message they hear, that message might impact somebody's life.
It is about ownership of this process by the government and the people, and it is about sustainability to ensure that the government has the capacities, the methodologies, the tools and the experience to take the issue of addressing HIV/AIDS forward.
Between 2001 and 2009, the rate of new HIV infections around the world declined by over 25%, including in some of the most affected countries and some of the most affected populations. A decade ago, virtually nobody living with HIV in developing countries had access to life-saving antiretroviral therapy. Now, almost 6 million people do. Some 13% of them, about 800,000 people, are on programs managed by UNDP.
Non seulement je suis médicament pour me vivre, je espoir pour me vivre, mais moun sa yo vinn ban plus espoir toujours que ma vivre, gen vie.
That's 6 million people who are staying alive, staying productive, contributing to their communities, 6 million people whose children are not orphans. We have reasons for optimism, but we also have reasons for grave concern. Stigma and discrimination remain major challenges, not just for people living with HIV, but also for populations heavily affected by HIV. That includes men who have sex with men, people who use drugs, people involved in sex work, prisoners, and so on. Nevertheless, we are seeing progress even on these very difficult questions of stigma and discrimination.
I think by protecting and advancing human rights, you actually are protecting and promoting the public health, because you're ensuring that no group gets left behind. If you leave groups behind, if you discriminate against them, if they're subject to stigma, how are they ever going to be reached?
Everything. That's why we are telling women to know their what? To know their rights. Are you happy to know your rights?
As the head of UNAIDS, Michelle Sidibe, has often said, HIV/AIDS, while a tremendous challenge, also offers opportunities in the process of tackling it. If we can get the primary healthcare response to HIV/AIDS right, we will hopefully be strengthening health systems which can then help to reach a number of other development goals and targets too.
Successful action on HIV doesn't just make a difference for MDG 6, AIDS, tuberculosis, and malaria. In fact, successful action on the social determinants of HIV, the kinds of legal issues, gender issues, poverty issues that most make a difference for HIV, also contribute to other health outcomes and indeed the MDGs more broadly.
You cannot have an HIV intervention successful without taking care of maternal health, of education, of gender relations. It's not a technical intervention, it goes beyond that and touches upon stigma, touches upon discrimination, touches upon social structures, and therefore the need for partnerships.
ท่านถือแล้วว่าทุกอย่างมันโยงใยกันหมดภาษาพระพุทธศาสนาเราเรียกว่าอิทัปปัจจยตาที่บอกว่าเด็ดดวงดาวเด็ดดอกไม้สะเทือนถึงดวงดาวหมายความว่าปัญหาทุกปัญหาในชุมชนเนี่ย เราไม่สามารถแก้ไขปัญหาใดปัญหาหนึ่งหรือแก้โดยคนใดคนหนึ่ง
There are so many different ways in which you can touch one MDG, like tackling HIV/AIDS, and have an impact on another.
Looking forward, we need to do two things. We need to continue focused work on HIV, but we also have to make sure that broader work on health and development is far more HIV sensitive and HIV responsive than before. The world is changing more rapidly than ever, and UNDP is changing as well, as we must. I look forward to working with you to shape that agenda, to make sure we understand and act on the synergies between health and development.